Hey everyone! In the previous video, we talked about the first cervical vertebrae or vertebral column, which was the atlas. And today, without wasting our time, we will talk about the general anatomy of the second cervical vertebrae of vertebral column, which is known as axis. So, axis is the second cervical vertebrae, and we will talk about the identification. It is easily identified with the presence of the dens. Dens, or the general name is odontoid process. It is also known as odontoid process. Now, the difference between the first cervical vertebrae and the second cervical vertebrae is the body. It contains a body and a spine, but the first cervical vertebrae, the atlas, doesn't contain any body and spine. So it contains a body which is present in the anterior surface, anterior side, and this is the vertebral body. Superior to the vertebral body is the odontoid process. The odontoid process is fused with the superior surface of the body, and this odontoid process articulates with the atlas. The oval facet, I told you in the previous video, the oval facet which was present in the atlas on the posterior surface of anterior arc. This odontoid process articulates over here. We will show you over here with the help of a diagram or the model like this. This half cut body is the atlas. This is atlas. The anterior arc contains the oval facet in the posterior side, which is articulated with odontoid process over here. This is how it articulates. Now, yes, then it articulates posteriorly with transverse ligament of the axis. So transverse ligament, now we will talk about its vertebral arc, which is the spine. First of all, the spine is thick. As you can see, it is properly thick, strong and bifid. This structure you can see over here is bifid structure. This is called as bifid. So spine is thick, strong and bifid. The transverse foramen, they are present laterally and directed upwards. These transverse foramen, these pink parts, are the transverse processes which are directed upwards and laterally. Superior articular facets occupies the upper surface of the body. These yellow parts are the pedicels. Okay, these pedicels occupies the superior articular facet where the atlas articulates. Similarly, the inferior articular facets are present in the posterior of the body or the pedicel of the axis. And now we will talk about the lamina. What is lamina? This little part, light green part, is known as the lamina. This is thick and strong. So this is all about the axis. I'm having a structure or a model, 3D model of axis. This is how it looks in real. This is not a real bone though, but this is how it looks. This is the odontoid process, and these are the transverse processes. These are the superior articular facet. These are the inferior articular facets. This is the lamina, and this is the spinous process, which is bifid in a structure, and it is the body. This is the body part of the axis. This is all about axis. Thank you.